My dear chairpersons and fellow delegates, lacrimal irrigation is the most commonly done test to assess the patency of lacrimal excretory pathway. But lacrimal irrigation cannot localize the site of obstruction accurately. A single finding may have several interpretations. For example, a clear regurg from opposite punctum may indicate blockage at common canaliculus or in the sac or in the NLD. At times, the traditional understanding of lacrimal syringing is just a supposition. This young girl with congenital lacrimal fistula, FDDT revealed freely patent lacrimal pathway. No exude from the fistula could be seen. Lacrimal syringing indicated presence of saline in nasal cavity. Some amount of saline oozed back from lacrimal fistula, and perhaps some of the saline regurgitated back to the conjunctival cul-de-sac. To confirm the regurgitation, repeat syringing was done with colored saline, and we found a good amount of fluid regurgitated back. We don't have any mechanism to calculate how much fluid regurgitated back. It is a common knowledge that lacrimal irrigation does create a hydrostatic pressure. We conducted a simple experiment. We threw camlin ink of different colors in air with the help of 1 mm, 2 mm and 5 mm syringes with same cannula and same person. And to our utter surprise, the throw traveled 8 to 9 feet of distance. We may conclude from this experiment that lacrimal syringing does create a very high pressure. That is why the throw traveled such a long distance. Because of poor reliability of lacrimal syringing, we started looking for other tests. FDDT is the number 2, but it cannot localize the site of obstruction. Lacrimal scintigraphy has its own limitation with very poor anatomical details. We were looking for an alternative without these limitations. That took me to my facial-maxillary radiologist regarding the cone beam computed tomography machine. CBCT is a dedicated CT scan for dentistry. We have been doing DCG with the help of CBCT since 2017. CBCT-DCG is done by installation of dye in conjunctival cul-de-sac. I repeat, dye is instilled in conjunctival cul-de-sac. Patient remains seated upright, normally blinking, and imaging gets completed within 13 seconds, making it a very safe procedure, and at the same time, all the physiological requirements are met. CBCT-DCG provides excellent anatomical details and localizes the site of obstruction accurately. CBCT-DCG utilizes the physiological forces to propel the dye along the lacrimal tree. This staged video of CBCT-DCG images showing the flow of dye from canaliculus to sac, NLD, and to inferior meatus. This middle-aged woman with patent syringing, FDDT revealed obstruction on right side. CBCT-DCG revealed pooling of dye in lacrimal sac, indicating blockage at the junction of sac and NLD, while the left side revealed presence of dye in inferior meatus, indicating its patency. And then we injected the dye, and syringing pressure easily negotiated that blockage. Dye started flowing through the NLD and just watch the pressure at which dye is squirting in inferior meatus. This gentleman with patent syringing, FDDT revealed obstruction on both sides. CBCT-DCG revealed pooling of dye in mid-segment of the NLD, indicating blockage. And then we injected the dye, and the syringing pressure easily negotiated this blockage, which was a dacrylith, and dye went all the way into inferior meatus. This lady with patent syringing revealed obstructed lacrimal pathway on left side with the help of FDDT. CBCT-DCG revealed obstruction at the level of common canaliculus, and then we injected the dye, and syringing pressure easily negotiated the blockage at common canaliculus. Dye started flowing through the NLD, showing multiple partial blocks. One more patient with patent syringing, FDTD revealed obstructed pathway on right side. CBCT-DCG revealed enlarged sac filled with dye, indicating blockage at the junction of sac and NLD. And then we injected the dye, and even in this case, the syringing pressure negotiated the blockage and dye went all the way into inferior meatus. Hence, lacrimal syringing is not a reliable test either for screening or for final diagnosis. Back to our first case of congenital fistula, and here CBCT-DCG revealed patent pathway, no regurgitation back to the conjunctival cul-de-sac seen. The fistulous tract got highlighted, but there was no exude from fistula. To conclude, lacrimal syringing application needs rethinking. CBCT-DCG is best physiological tool to assess lacrimal passage. It can pinpoint the site of obstruction. CBCT-DCG has in abundance what lacrimal scintigraphy lacks. CBCT-DCG cost ₹1,000 only to the patient. Thank you.